Okay, guys, welcome to all my fellow nursing students and colleagues. So right now I'm excited to introduce to you Teresa Becker. She's a registered respiratory therapist and professor at one of the local community colleges. Today she joins us to shed light on the important partnership between registered nurses and respiratory therapists, especially in the intensive care unit. So welcome, Terry. Thanks for being with me today.
Well, thank you for having me.
So what would you like to tell us?
It's very important for ICU nurses. It's very important for any healthcare professional to work collaboratively with other disciplines, with housekeeping, with specifically in the ICU with intensivists, dietitians, caseworkers, social workers, specialists. We all should work together as a team. We all have specific jobs, but we need to work together as a team to deliver optimal care, the best care to the patient.
Exactly.
Again, each person has their specific job, but nobody, there are some shared responsibilities. For example, interning patients in the ICU, feel free to ask a nursing assistant or respiratory therapist to help you. In terms of suctioning or any other kind of care, it's pretty much understood in most hospitals that suctioning is a shared responsibility, although a respiratory therapist may have the whole intensive care unit. Nurses, at least in the hospital I work in, have a 2-to-1 ratio. And when I say shared responsibility, some nurses are not comfortable suctioning intubated patients, which is understandable. But everyone learns how to do suctioning in the intensive care, in nursing school. And our team may be busy in another room where your patient needs suctioning. So again, please feel free to step in and suction, and the RT will help you when you need help with your patient if you can't call on another nurse to come and help you. Collaboration is especially important when we're intubating a patient, because there could be one respiratory therapist in the room who helps intubate the patient, secure the ET tube. We always ask if there's an extra RT in the room, great. If there isn't, we ask the nurse to listen for breath sounds because our hands are busy securing the ET tube, setting up the vent. So of course, once you intubate a patient, you listen for breath sounds, and you want to hear breath sounds in the airway, the lungs, and you don't want to hear it in the stomach. So when you've just intubated a patient before you hook them up to the vent and you're bagging them, you want to listen for bilateral breath sounds and no breath sounds in the stomach. So we sometimes ask nurses to do that. Nurses ask us to adjust the ET tube if they need to put in, an OG tube or an NG tube. So we do work together. And again, you work with other disciplines too. Housekeeping is very important. They're very underappreciated. Worth their weight in gold, because if you have housekeepers that don't do a good job, then your patients, don't have a very good outcome.
Right.
So it's especially important to treat housekeeping, with a lot of respect, because as again, they are the most underappreciated department in the hospital.
Very true.
So teamwork, teamwork, teamwork.
Exactly. So I have 2 questions for you, Terry. The first one is I want to hear your thoughts about what advice you would offer a new nurse. And I mean, you just graduated yesterday, who's considering starting their career in the ICU unit first prior to any other floor.
Ask if you're not sure. Don't be afraid to ask your RT if you need help with something or you don't understand something. We get a lot of questions about the ventilators, and that's perfectly understandable because, I say we grow up, we go through school learning all about ventilators, and depending on your level of experience or even the different ventilators that you've worked with, you may not understand. I mean, you understand like the basic components, tidal volume, PEEP, respiratory rate, FiO2, but you may not understand where to find those on the particular vent. So feel free to ask your respiratory therapist for help if you don't understand anything. They don't assume that you know everything, just like you shouldn't assume that they know everything. But if you're not sure about something, ask for help.
Okay. And my last question for you, because this woman is really busy. Okay, she just finished teaching a bunch of students today. My last thing is, what kind of improvements would you like to see between registered nurses and respiratory therapists on either the ICU or any other specific unit? Because I know you work through more units than just the ICU. So which one would you like to point on?
It's really important to communicate with your RT, particularly if you need to take a patient on a transport, because the RT can be busy on the floor, and an intubated patient, and I'll address ICU specifically. An intubated patient needs to go for a CAT scan or an MRI or down to have a special procedure done. They need to have the respiratory therapist accompany them. I haven't worked in any hospitals where the nurse just takes the patient down by themselves, because if the patient loses the airway, then the RT has to be the one to help reestablish the airway. If something goes wrong with the vent, the RT needs to be the one to troubleshoot it and fix it. It's a good idea to coordinate with the RT when you need a transport. I know you're always at the mercy of when the CAT scan or the MRI is available, but as much as possible, try to give the respiratory therapist a heads up as to when you're going, because the RT may be busy with another patient that takes a long time, and they may not be there. They try to be available when you're ready to go, but as much as possible, communicate with them a time frame for a transport so they can make sure that they can dedicate themselves to you at that time. And in terms of weaning from a ventilator, it's always good to coordinate with the respiratory therapist, because when you put the patient on a spontaneous breathing trial, you need to lower the sedation. So you need to communicate with the RT when that's going to happen, because you don't want to not lower the sedation on a patient that you're doing a spontaneous breathing trial on, because then the spontaneous breathing trial won't go well.
For the students, can you mention what sedation that we're talking about? Just name a few, like propofol, a few of them.
Yes, propofol, and that's pretty much the one that we work with.
Okay.
But
Okay.
just turn off the propofol or lower the propofol, because when you want to put a patient on a spontaneous trial, you want them to make an effort to breathe, and they can't do that if they're heavily sedated, like they would be if they're intubated.
Thank you so much.
Communication, teamwork. Now, in terms of on the floors, patients on our floors sometimes have trachs, and they also in the ICU, sometimes a trach patient is hooked up to a ventilator. Sometimes a trach patient and a regular med-surg floor isn't necessarily hooked up to a ventilator. They may be hooked up to a trach collar where they're getting humidified air, or a high flow nasal cannula. Those need, in our hospital, those patients need to go down with a respiratory therapist as well as a nurse. So again, coordinate with the respiratory therapist when you need to do a transport, so they can be free, to go with you.
You're awesome, Terry. Thank you so much for just taking the time out today just to shed some light. So the students are, new nurses, and the students preparing to become nurses, they get an idea. It's all about the interdisciplinary team. It's all about teamwork, period. You have to have your therapist, your case manager, your doctors, your specialists. We all work together for the good of the patient. It's no one person doing everything. Without each other, it just doesn't work. So,
and that's especially important if you have a medication change, or you need to communicate that with the doctor. You need to communicate that with the nurse too, because medications do change. Doctors don't always remember to, I say, put in the orders, but it's important to communicate with the nurse, and with the RT. It's important for both parties to communicate with each other whenever there's a medication change, whenever there is a change in patient status. And it helps keep patients' families, up to date with what's going on, because that's
huge. They're a huge part of the team, guys. The family. Oh my God, how could I let them out?
Yep, it's very important. You know, family is a huge part of, you know,
Huge.
a patient's, you know, outcome.
Yeah,
And it's very important to communicate with patient's family too.
that's beautiful. Thank you so much, Terry, for taking the time out. We really appreciate you.
Okay, well, thank you for having me and good luck to you all.
Thank you. Have a good one now.
Okay, all righty. Thank you. Bye.